Each year during June, Men's Health Month brings awareness to the health issues all men face. It's a great time to encourage men to see their doctors for early detection and treatment, especially when it comes to one of the leading causes of cancer-related death in men. Bridget is standing by now to ask a doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
The CDC reports all men are at risk for prostate cancer. Out of every 100 American men, 13 will develop prostate cancer over their lifetime. Joining us today, Dr. Duron Lee, primary care physician with HCA Florida Osceola Hospital. Thanks for coming back in.
Good morning, my pleasure.
I know you're busy. The overall topic of men's health, the overriding theme seems to be men need to get in for their annual appointments regularly.
Absolutely. I mean, that's the best way to prevent disease from advanced stages is seeing your primary care doctor.
And one of the most common one of the common health conditions that comes up is prostate cancer. And what should we be looking for as far as signs and symptoms with that?
Sure. Prostate cancer is a real concern in men. It's the #1 cancer in men. Approximately 250,000 men will be diagnosed with that this year. It's estimated that 35,000 may die from prostate cancer. The main thing with cancer, prostate cancer in particular, is a disease that comes on with advanced age. So particularly with men above age 50, we need to be particularly concerned about prostate cancer.
Is it true that, over time, like you said, it comes with age usually? Do a majority of men eventually develop it into those later, years, their 80s, 90s? Do you find that it may not be a cause of death, but they've developed it by that age?
Absolutely. It's very common in men. It's the #1 cause of cancer in men. The thing with prostate cancer in particular, it's slowly growing, and usually the signs and symptoms present when men are above age 50. So some of the risk factors, for example, are #1, man with a prostate, first and foremost, but advanced age. So we begin to recommend screening above age 50. Other things that contribute, lifestyle, so obesity, a poor diet, high in saturated fats, low in fiber, those things can also contribute to your chance of increasing your risk of prostate cancer.
Do we know why that contributes to the prostate developing cancer? Have we figured it out?
We really don't know. It's a combination of genetic and environmental factors. So in some individuals, we know that the BRCA gene, 1 and 2, is commonly associated with breast and ovarian cancer. We have also found that men who have that genetic predisposition have a higher incidence of prostate cancer as well.
And so when it comes to the screening, that's another thing that men typically don't want to talk about, and it's awkward. So what can you tell us about the screening and when the gentleman should start getting those?
Sure. Screening provides the best opportunity to detect cancer before it reaches advanced stages and potentially spreads to other areas of the body. There are two main ways of screening for prostate cancer. A simple blood test called a PSA, or prostate serum antigen test. It's a simple test that can be done by a doctor. Another one is an examination, a digital rectal exam. The most important thing is really the screening process should be individualized, and it should be a shared decision-making process between the individual patient and their provider. It takes into consideration the risk and benefits, the limitations of screening, the patient's underlying wishes and desires, their values, etc.
So what's the age range you should start with those screenings?
We recommend anywhere between age 55 and 70. However, because certain ethnic populations, for example, men of African or Caribbean descent, have a higher incidence, it may be recommended that those individuals start screening at an earlier age. But again, the conversation should be had between the individual patient and their primary care provider.
What are some of the warning signs of prostate cancer?
A lot of times there are no warning signs. It's a slow, kind of indolent growing cancer. But the majority of symptoms that do occur are urinary symptoms. So men may experience difficulty with urination. They may have painful, burning urination, difficulty with starting or stopping a urine stream, pelvic pain, bone pain, fatigue, weight loss. Those are some of the signs, particularly of advanced stages, but the majority of symptoms are really absent, particularly in the beginning stages.
Talk to us about recovering from it, treatment options, because people can't beat this.
Sure. There are a whole host of treatment options available, and again, it really depends on the individual, the stage of the cancer, the underlying health of the individual. But there could be options such as active surveillance, just watching and waiting and no immediate treatment. There could be surgery where you get the prostate removed. There's also types of medications that you can use to fight prostate cancer. There's immunotherapy, hormonal therapy, chemotherapy, radiation. So there's a whole host. Again, it really depends on that individual and the stage of that disease.
Yeah, and it's something that is so common. It is treatable, and you can have many healthy years even dealing with this condition. But it's important to get in and get your care plan together.
Absolutely.
Yeah. Anything else we should add?
No, it's just I recommend everyone to get a primary care physician and undergo your yearly annual screening and all your health maintenance preventive screenings as well.
All right, sounds good. So we need to get those men into the doctor.
Absolutely.
All right, Julie, back to you.
Thanks, Bridget.